and changing the narrative. We have a number of high-profile guest speakers coming to talk around the journey, really, from a young person, from that developmental trauma that they may have experienced, right through to students that are in further education. And so hopefully some of you may be able to join us for that. We will send out this PowerPoint presentation, so you've got a copy of it, and at the end we've added the flyer regarding next week, so that if you did want to sign up, we do have some spaces still available. So moving on, as I've talked about before, there is this current situation within education, and we've seen a real high number, or an increase in students with mental health difficulties. And from some of the research that's been done, that we're seeing that these are the types of figures related to students that are in education and what they're saying. And we've also seen how the increase in learners that are needing to access CAMS, and we're seeing how so many young people are at the cusp of being able to access CAMS, and there's just not that support available. So as a college, we needed to consider what we were going to do to enable students to access support that wasn't necessarily going to be available to them through external organisations. So our situation is no different to what you're seeing across your organisations and within your college. So this is what was happening at Weston College, and we were seeing huge numbers of learners coming through to see the welfare team, and that in 2017-18 you can see that there was that was the level of students that were needing interventions, but also that how many conversations we were seeing on our ELRP system that related to mental health, and that we had this small mental health team at the time, and every week we were having 5 new referrals that were coming through. We were also looking through the systems for staff, and actually the staff absence, 4% of the absence levels were related to stress. And talking to our young people, that only 34% of students completed, or 34% of students say they complete less than 1 hour of exercise a week. And as you're all aware, the real need for that physical exercise and to really look after ourselves. So it's what we were going to do as a college to respond to meet the diverse needs of the learner population. So we started to look at how we could create this transformational approach, and we looked at the AOC best practice self-assessment for mental health and wellbeing as a first stage to enable us to see where we were. So we used it as a framework to identify where there was good practice, but where we could improve. And this is the 6 initiatives that we felt we needed to really focus on, enabling us to support the college's strategy around supporting learners and staff. So we took the approach that it wasn't just around the welfare team, it wasn't just around the support services, and it wasn't just around HR, but it was about bringing all the key areas of the college together to create this transformational approach. I'm going to ask Liam now to put the short film on, which will contextualise what we've done a little bit better than I'm doing. So hopefully you'll be able to hear this, but it was about bringing those 4 teams together to create a framework. And our framework at Weston College is referred to as BAM, which is body and mind.
As one of the fastest growing colleges in the United Kingdom, we are having to change our strategies because without doubt, we are now facing one of the biggest social challenges that society has ever faced. As a college, we have addressed this collectively at every level. We have a strategy to engage governors, key departments, external community partners. There is one singular aim: to create a culture of positive mental health that benefits both students and staff. At this college, we've done an enormous amount of work within the field of inclusive practice. In 2018, we were recognised for our work nationally. We won the highest accolade in the country for both FE and HE within the Queen's Anniversary Award. In order to align to key policies, we ourselves have had to align internally. As a result, we now have 4 key departments that work collectively. This encompasses welfare and pastoral, inclusive practice and mental health, sport and enrichment, and human resources, all under a common body and mind framework. Using best practices such as the AOC self-assessment toolkit, we have been allowed to see how we can work seamlessly to benefit staff and students. Our teams are engaging with the latest technology to help those hardest to reach. In addition to the support that every department offers, we now have practical initiatives that span every campus and the community. This enables staff and students to improve physical health and mental well-being, and that in turn improves attendance, engagement, and peer-to-peer support.
So as you can see, we created something called BAM, which Dr. Paul Phillips contextualised around the 4 main areas that came together, so that everybody in the college knew that there was a really clear strategy to support learners, and we were working really closely together from human resources, the mental health team, sports and enrichment, and welfare. So through that, we were able to create 3 different levels of support that we would offer learners and staff. So the first level of support was we refer to as our universal support, and this is for all staff and students, which is through the pastoral support services, through using technology such as the Big White Wall and our welfare teams, and working as a whole college and with external agencies, so that there's support for everybody, whether it be for housing, whether it be for healthcare needs, whether it be using the enrichment program here at the college, but it's for everybody. And we also looked at support mechanisms for staff, whether that be through occupational health, and also we have a Bupa scheme that is available to staff to access as well. So that's our kind of whole universal approach that's available to everybody. We then focus then on our targeted support, and that's for students and staff who require something additional to the universal support, and that's around creating bespoke packages of support. So for example, we will work with the enrichment team to look at a sports program for a group of learners, or for a group of, for example, a group of childcare students who may want something very different to what the carpentry students want. So it's looking at setting up health and wellbeing sessions, but it's all around what's needed within a faculty and specific to a group of students. And also looking at how we can support our staff through that, through access to work, counselling. We've also got a mentoring scheme in place for all new members of staff, and we've also employed a staff welfare officer, who is that real, that person that can work alongside managers to make those reasonable adjustments and to access additional support outside of that direct line management, which has been crucial in enabling staff to have that voice around some of the difficulties that they may be experiencing. So we've set up lots of staff initiatives. There's yoga programs, there's a running club, we have access to the staff gym, and it's not just around sporting activities, but other activities to engage staff in supporting them with their mental health and well-being. But then what we've moved on to, and it's for those learners that are really having a crisis within their mental health, and this is our specialist model, and this is where there are really complex cases, and we're seeing more and more of these complex cases, and we've actually doubled our team of specialist support staff that are working within the mental health area, so that this is really giving specialist support, and it's real. It can be in a 12-week program, a 6-week program, a daily basis, and it's really how we can individualize a learner's program so that they're able to access this specialist support. The college developed the specialist support model back in 2006, when we really needed to specialise and enable staff to be really highly qualified in the different areas of SEND. And we started looking at specialising in students with more severe learning difficulties, and then specialising further in autism. And in the last 7 or 8 years, that's when we've really had to focus on mental health. So we have a foundation degree that we offer staff so that they're able to specialise in the area, and mental health modules have been added to that degree, so we can have a really highly qualified specialist team. We employ staff on the same scale as a lecturing team, so that there's parity between curriculum staff and specialist staff. And it gives them the opportunity to really understand the learners' barriers. So for example, within the mental health area, it's about understanding the difficulties and the different diagnosis that a learner may have, and being specialist in that area, so that we can then empower learners to understand how their learning barriers and their mental health impacts on them. And we can work really closely with the curriculum staff so that they can differentiate what's needed in the classroom for those learners. So our specialist model goes across all areas of the college and all our campuses. We have a number of different specialist teams that are employed, and that's when they're working on the real specialist programs with the learners, enabling them to be successful. So some of the things that we've done within our specialist team is to enable staff to be empowered so that they feel confident and comfortable to discuss support needs for learners with mental health. So we've developed a training program and a suite of qualifications that we offer staff, whether that be the mental health first aid training, Connect 5, suicide awareness, eating disorders. There's lots of different training programs that staff can access, all staff across the college. And we also created a number of key events that took place. So we have things like Hello Yellow,
That's it.
that takes place. We have Mental Health Awareness Week. So we're really ensuring that it's something that's not celebrated, but it's talked about within the learner population and within the staff population. They're not scared to disclose the information, so that everybody can see how much the college wants to support learners, whether it be through the BAM programme or through that specialist support. But what we would say is that it's about promoting the active lifestyle of the learners in the classroom and outside of the classroom. And obviously it's key to be engaging and collaborating with the local services outside. But it's about making sure that you have a formalised approach within your organisation. And the key to success, we believe, within our organisation is about the buy-in from the senior leadership team and being led by our principals, so that ensures that we do have that whole organisational approach. We were selected a number of years ago, 2 years ago now, to be a Young Mind Amplified, to be on the Young Minds Amplified Trailblazer, and those were some of the things that they helped us to develop within our organisation, so that we could increase the skills and knowledge of staff and young people, and we were able to improve the social and emotional outcomes for the learners. So moving on from that, it enabled us to set up lots and lots of initiatives across the college, so that we were able to demonstrate to the young minds how we were really engaging within the services, within the organisation. And these are some of the things that we came up with. So we had held a national trauma conference. We had a real media focus, a social media focus to support learners, and that's where we're also highlighting to learners the Big White Wall, which is a toolkit that students can access outside of the daily running of a college organisation. We've had a real focus on male mental health within the college, and this has been led from the Charlie Waller Trust, which is a big collaboration that's happening nationally now regarding young people. And Charlie Waller was a student who committed suicide. We've done lots of work around eating disorders, and we've created BEAT student ambassadors amongst the college so that they're working with other students. So there's peer-to-peer support for learners regarding eating disorders. There's been lots of regular student blogs which have been looking at their journeys and what's happened to the learners. And obviously we've been looking at all tutors and the mentors and the governors and the senior leadership team all going through the mental health first aid training. So as a college, we've done lots and lots of work with to enable us to really support the learners with these complex barriers. Once a learner has been identified as needing a high level of support, that specialist level of support, we use a referral system, and it may be initially through the welfare, it may be through the tutors, it may be through parents that actually refer to us. So Bex is now going to talk through how we get that information about those learners once they are in what we call crisis management.
Thank you. So going through the slide here, the people come through to us, our learners come through to us, they're referred through to our mental health team. We assess that weekly, and sometimes if it's urgent, for example, if a learner is suicidal and is in a real crisis point and can't come into college, etc., we will assess that immediately. We'll decide whether that referral is appropriate or not, because sometimes referrals do come through that aren't appropriate and they may need a different strategy or need to take a different pathway. So you can see up there we use different strategies there, welfare help. We make sure that we're educating people around self-help, online resources that are available, etc. If the referral is appropriate, it comes through to our team. It's allocated to a practitioner according to the level of need within 1 week, and we do try to make sure that we contact that person as soon as possible and see them within a week. Sometimes, obviously, if the need is more urgent than that, we'd see them sooner. The learner and then the referring staff member are updated. It's really important that we keep our communication on point, and the initial assessment phase begins. So in that initial assessment phase, we look at the learner specifically, we look at tailoring support to them. So we would make sure that this is person focused. It may well be that they sit in different tiers and levels of support. So we need to work out where they sit within our team. We will look at their wellbeing scale scores. That's WEB, WMS. That's a wellbeing scale. We look at their baseline, where they're at the moment. We look at their targets, their goals. We look at who they are as a person, what motivates them, and what the crisis actually is, and make sure that they're involved in that. And then depending on the learner, we go through the different pathways. So it may well be that they're with us for a bit longer, in which case they would go off to the right, the progress pathway, the learner journey commenced, and they would go through various reviews, and we look at their targets and we work around different things, which I'll explain a bit later. It may be that they go off to the left, and they're a slightly shorter stay with our team. So we base it around the learner. We do review targets. We make sure that we look at their wellbeing scale along the journey, and we're comparing that as they go along. So in terms of the different tiers, thank you. I don't have a clicker, Sam's helping me. So in terms of the different tiers of support in our service, we cover an awful lot of different interventions, because mental health is not simple. It's very complicated, and all of our learners are very different. So we have to be flexible as a team. The most important thing for us is to build a relationship with the learners. That is absolutely key. We need to make sure that they feel that college is a safe space. They have somebody to go to, they have someone they can contact, and that they see us regularly and they feel supported, but more than that, they feel validated. We look at the learners. So we have various tiers. I'll just talk through the tiers. We're split into 3 different tiers. You can see kind of at the top, the tier 1, there is no specified time frame there, and that's where we work with learners who may have very complex needs. They may have just been discharged from a section or something like that, just come out of hospital, or they may not be able to come into college at all times. And we work through those different things there, which I'll explain in a minute. The tier 2, no specified time frame again, that is for learners who do have complex needs and they need more than a low level intervention, but they're not quite as complex. We were finding there was a layer there that was kind of, the two bottom layers quite often get missed outside of college in general support around mental health. So we needed to make sure that we targeted those learners as well. Those learners, they would work with somebody such as myself. We would see them usually weekly, sometimes fortnightly, depending on the learner. We would look at those different areas. And then the third tier is a very structured, specific 6 to 10 week coaching block around CBT and the things there. So just to explain a few of what these interventions actually are, dialectical behavioural therapy is very specific. With that, we tend to use that around people who have things like personality disorders, who find emotional regulation really difficult. It's about staying in your rational mind. It's about knowing that it's about moving away from black and white ways of thinking and understanding interpersonal relationships. It's also teaching emotional literacy and interpersonal relationship skills. Emotional regulation is really important for our learners because classroom settings can be really difficult at times. So we teach people, again, emotional literacy and how to manage that day to day. We do a lot of outside agency working, joint working with CAMS, joint working with intervention teams, intensive support teams, making sure that our communication is absolutely on point because we all have to work together. We build a lot of robust plans with people around specific learners, especially learners who do have personality disorder, because you need to be very specific in your approach. So we understand that and we make sure that our communication is on point. In terms of suicidal and self-harm crisis, we do a lot of practical interventions. So things like de-escalation in the moment when somebody's having a panic attack. We have various ways that we can de-escalate people, mindfulness in the moment, trying to work with somebody around a safety plan, working with people who are close to them, they're connected with, such as their family, and what to do outside of college, again, working multi-agency as well. In terms of self-harm, we're lucky to have healthcare assistants on site who can help with any kind of healthcare needs the learner might have as well, which is really, really helpful. The most important thing for us is that there's no judgment around mental health and self-harm and suicidal thoughts and ideation, and that we're helping people to build strong, robust coping strategies around that day to day. So as something happens, we tend to review the incidents as well and see if we can work out a theme, a train of thought, something that we can then target in future.
I think it's important to add here that the specialist staff will then work really closely with the personal tutors so that they understand more about the specific difficulties that the learner's experiencing and how there may be some small adaptations that can be made in the classroom environment, or certain wordings that can be used, or how we can adapt their timetable so that we can sometimes take the pressure off of their achievement within a certain period so that they can still be attending college, and we're using an individualised programme to allow them to still continue that attendance, but maybe reducing from 3 A levels or 2 A levels to 1 A level, or maybe looking at a different type of qualification in the first year for a learner rather than a full level 3 diploma. It may be a subsidiary qualification that goes alongside that. And I think what we found is by keeping the routine of a learner coming to college, but taking the pressure of that achievement off, has really helped in their recovery, because they're seen as they're still making progress within an organisation and they're still being seen by their peers to be attending college. And that's been so important in many of the learners' recovery.
Absolutely. Just to explain a bit about cognitive behavioural therapy as well, that looks at the way that people think and challenging unhelpful thinking styles. We also look at things like behavioural activation, making sure that people are getting out and about. We scale behaviours, so if somebody is only at a 1 at the moment on their scale, then we only look at getting them up to a 2 for now. We don't try and get people up to 10 because it tends to cause breakdown in terms of mental health. So we do a lot of scaling with our learners. In terms of depression and low mood as well, we do look at a lot of problem solving skills, barriers that people face and what resources they have. we look a lot at self-esteem and self-worth, self-value, and strengths and weaknesses, and ways that the learner can work towards their own personal goals. We have a specific focus on not taking over for a learner, but making sure that the journey is something we do together and the learner has control over that journey. So they feel empowered and not disempowered. We don't take over, we make sure that they learn the skills and that they implement the skills, that we can't do that for them. We do a lot of signposting externally. The Big White Wall is an excellent resource. It's our online platform that we use that has a lot of self-help. Also, it has a lot of chat rooms, and people are able to post threads and they get responses from trained professionals. All of the responses are monitored so that there's no worry about trolling or anything like that, which is really helpful. It's a very safe space. In terms of the coaching, the tier 3, that is a very, very structured coaching block, and it's useful because there are a lot of learners who we did find were being missed out, who didn't meet the threshold for external services, but their mental health issues were affecting them day to day. So they might not be able to attend college, their attendance was affected, their work was affected. So it's really useful to be able to have that, just 6 to 10 weeks of coaching so that they learn their most basic practical skills in order to address those issues day to day.
I think it's important there to also add that once the learner has had a 6 to 10 week coaching block, they may then go away and be putting some of those coaching tools into practice, but it doesn't mean to say they can't come back in to the coaching at a later point in the year. But again, the empowerment is so important to us for them learning those strategies and then putting them into practice and not becoming reliant on seeing a member of staff within the mental health team every week, because that can also come with difficulties in itself.
Absolutely. Another thing that we work around in terms of anxiety is looking at the anxiety loop and overcoming avoidance behaviours. So we do a lot of kind of graded exposure with a learner, and a lot of very, very practical things that you can do. So for example, if you just hold your hands up in front of you and hold each finger to your thumb in turn, like so, it's a really good, if you do that nice and slowly, it's a really good mindfulness grounding technique in the moment to help learners to de-escalate their brain. And they quite often repeat a mantra such as calm begins with me as they do each finger or something like that. And these are just an example of a very, very basic, simple strategy that helps people day to day. And obviously there are some more targeted, focused things in the cognitive behavioural therapy, dialectical behavioural therapy, etc. that we do as well.
So I think that, we're really lucky at the college that we have this model where we have specialist staff that are working here. But alongside the investment in the specialist staff, the college has also looked at some online technology. So as Bex has mentioned, we have the Big White Wall, but we also have Couth, and you may want to go away and look at those, both examples. The Couth is a platform that's more appropriate for learners who are maybe SEND learners with lower levels of literacy, so maybe more entry 3 and level 1 learners. We would say that that's more appropriate for, because of the language that's used and how students are able to navigate that independently. So I think that just looking at, as a college, in order to ensure that we've been able to respond to the crisis, the learners that are in crisis with their mental health, it's been about ensuring that we've got that really clear strategy, that whole college approach to mental health and well-being. And it's through that investment in ensuring we have really highly qualified specialist staff that are able to give this specialist level of support, and the programs that are delivered, as Bex was mentioning, and how we've invested in CPD across the organisation. Once people have been trained through the mental health first aid, there's a numbers of working groups that are set up so that staff can continue to access support from the mental health team, but also are there to support their peers within their curriculum areas. So they become like mental health champions within their own faculties and their own teams. It's really important that we've had strong collaboration between HE and FE, and we're to be able to share the best practice, and then that's enabling us to ensure that there's really seamless transitions between the college, but also into apprenticeships, HE, and also into employment for learners, and working with employers so that they understand through our specialist apprenticeship team what the needs of the learners are as they progress on. As I said, we developed a foundation degree to train staff to degree level in mental health and wellbeing, but also there's other modules in SEND that's within that. And the other part that we'd say was our relationships and our partnerships with the local authority, the CAMS, the crisis team, the early intervention team, to enable us to refer between organisations and support one another in the interventions that are being provided through that multi-agency approach. Obviously, there are still lots of challenges, and these are the things that we consider to be the challenges within, making sure that our provision is consistent amongst the kind of work-based learners, as well as learners that can access college on a more day-to-day basis. It can be more difficult for those work-based learners because they may only come into college for a short period on a weekly basis, and for some learners they may come in less frequently than that. So it's about getting that support to them. So we're looking at more virtual ways of supporting learners so that they still have the access, but they don't physically need to be in the college buildings. It's important to recognise that within each of our campuses, we have 3 main campuses at the college, and within each of those campuses we have the same resources available. We have a low arousal room, we have learning support bases, as many as you'll have, but we also have a mental health hub for learners where staff are available and base themselves. So, and they're a slightly different setup to an office or a counselling room, but it's really ensuring that learners feel relaxed and safe within those environments. It's also making sure, one of our challenges we've seen is about making sure that the learners that really need the support are getting the support, because many of the learners may not, that have really significant mental health crisis, that may not be referring, but that's where it's so important that staff are trained in looking out for those signs and listening to their learners. So I don't know whether you have any questions that you'd like to ask, or any further information you'd require regarding our college practice and what we can share with you within your organisations. So I don't know if Liam, if anybody's got any questions, if you want to type those in, we'll just take a second to see if anything comes through. So we've got a question from Kerry about how we are funding the posts. We do fund the specialist posts through the high needs funding. We have worked really closely with the local authority to recognise that our local authority uses a bandings and categories model. So we have a category related to mental health that accesses levels of funding for learners that need that specialist intervention. I hope that answers your question.
Kerry has just asked, what qualifications do the practitioners have?
All specialist practitioners have to be qualified at degree level. So it may be the foundation degree that we have trained staff through. Some of the staff may also come to us through different routes, through having being a mental health nurse, having psychology degree. Bex, can you think of any other qualifications?
No, I don't think so.
They are all degree level. We won't employ anybody as a specialist, and it has to be a relevant degree within the area. So we are looking for degrees in mental health in order to. The college also runs integrated health mental health degree, and also so that uses a pathway for staff to qualify and be trained at degree level. We do have some coaches as well that aren't trained to degree level, but they're usually on a degree pathway, and that's the third tier that Bex was talking about, where those 6 to 10 week programs that might be run by a mental health coach, but is overseen by a mental health specialist, and it's a very prescriptive course that the learners are undertaking. But somebody that was in significant crisis or are very unwell, they wouldn't be seeing a coach. They would be seeing a specialist.
Teresa said that this is a really comprehensive approach, very impressive. Do you deliver the mental health degree and training on specific issues, e.g. eating disorders internally or with external agencies?
We use a combination, is the honest answer there. What we find is that we do have many staff that are our managers within the college, and specifically with the inclusive practice faculty that have that experience and have worked in Georgie, who I know you've met, Teresa. She has worked in secure units, and our specialist practitioner Debbie worked in a hospital environment, so they will then contribute onto the degrees. However, we recognise our limitations as a college, so we also bring in external guest speakers to deliver parts of the units within the courses, so that we're making sure that the students, as we're training them, get access to a wide range of specialist teaching. I hope that answered your question.
Carrie's asked, could you share with us your baseline assessment?
Yeah, I'm sure we can. Yes, no problem. We can send that out when we send out the presentation. We do one called initial needs assessment, and that's more of a triage process that we use to establish what the needs of the learners are. But then we have some more specialist assessments that take place, and we'd be more than happy to send those out, no problem.
Teresa's asked, on the crisis management model, learners who require support are referred to a practitioner. Who might that person be in practice?
That would be one of our specialist practitioners. So we have a team of people that work across the organisation. As Bex was saying, on a weekly basis, we look at all those new referrals that come in. Excuse me. However, there may be times when a learner or a member of staff comes to us and actually that needs to be actioned that day. And depending, it may be that a learner needs to be sectioned. We've had a few situations recently where we've had to ensure that a learner's has been safe on the college whilst the team and the police have been involved in actually sectioning some young people. But it would be usually on a weekly basis where they would go through and look at the student initial assessment or the referral that's been made, and then who the best person is. So depending on what the needs of the learner are, it depends on who we match the student to. So we try and match the student to the skills of the member of staff. That's right, isn't it?
And it's flexible as well. So if we find that they start on a coaching program and that's not enough, we'll move them to the right person afterwards.
Kerry says thank you. And Jane says, once somebody has moved down to tier 3 or finished with the support, how are they monitored for the rest of their time at the college?
So I think that we always keep in touch with learners, and those students that have had those programs and that they're no longer needing access to specialist support, they're always popping by to tell the staff how they're getting on and to celebrate the successes. So we do still see them regularly, but that's where we've trained the cross-college staff or the curriculum staff so that they continue to monitor the learners in the lessons. So if any concerns, whether it be a parent or a tutor or they would then be able to they would refer them back in, wouldn't they? They would then access support again. So although they finish that programme, we still monitor what's happening with them.
Yeah. And we work really closely with the welfare teams as well. They let us know if anything has come up. Yeah.
Ryan Pickering's asked, do your teachers deliver mental health training through tutorials on their study programme, or is it delivered by specialist staff at another time?
It's through a combination. We have a programme that is run as part of what we refer it to is called individual development, and it's looking at that resilience and that personal and social development. So we have some parts of it that are run by the personal tutors, some parts that are run by the welfare, and we also have a number of learning mentors that are also working with the learners. So what we try and do is look at the needs of the group in the first instance to identify what their areas of need are within their curriculum, outside of within their programme of study, outside of their qualification. And then also we'll look at specific needs of certain groups. So we will then individualise the timetable, because we may need for certain groups or certain students within a group to have more access to that resilience and that kind of personal and social development.
Kerry's asked, who assesses the initial assessment?
We have a large team that will be doing initial assessments as part of enrolment at the beginning of the year, and working with the faculties through, we have campus coordinators that are within SEND that they may do that initial referral and talk to the learners, and it may be the welfare team that do that initial referral. But then as soon as they identify that there's a need that is bigger than that universal support that the college gives to all learners automatically, it would then be a specialist support member that would do that kind of more detailed assessment around the kind of triage of where they go into the kind of tier process. Anything you wanted to add there?
That's right, yeah.
Teresa said, thank you for answering her question, and has asked whether the supporting staff and students toolkit can be shared.
The supporting
staff and students toolkit, can that be shared?
Which bit are you, can you just clarify, Teresa? Sorry. Is it part of the individual development that the learners do as part of their programme of study, that support toolkit? Or do you mean examples of the toolkits that we give the learners once they're accessing specialist support?
Teresa, sorry, as mentioned earlier in the presentation before the specialised model.
Yes, yeah, no problem. We can add that to the links as well.
Jane's asked, what information can be shared, if any, to ensure a learner continues to be supported by carers, family, employers, etc. after they leave college?
Good question, Jane. We try to empower the learner to take responsibility or wanting to actually share that information. But for many learners, when they're progressing out of the college into employment, they don't want to disclose. That's why we work really closely with the specialist team that are linked to the apprenticeships, so that they can work with the employers and support the learner to explain to the employer their barriers or their difficulties. But it is difficult, because some learners do not want to disclose, and for any learner that may be over 18, they may not want to have their parents' involvement. But we just constantly encourage them and say that it's not, we're trying to break down the stigma here around mental health, and it's not, we're trying to see it in as that affirmative model of disability, as opposed to that medicalised model of disability that enables us to give see it obviously is as a hidden disability, but see that small amount of support and what those small adjustments can make the difference between somebody succeeding in a job or not. So we try and get the students to disclose as much as possible. Would you add anything there?
Yeah, we also work a lot around very practical advice and tips around how to speak to your GP, how to explain it to people. And we have worksheets that we go through with people that ask specific questions that are really helpful, and also looking at people's ways of thinking, biased expectations, and trying to break down some of those barriers to make sure that that's actually possible.
Kerry's asked, is it case loaded?
Do you mean case loaded? Do you mean how many students does each member of staff work with? I'm presuming that's
yes,
what you
does,
mean. Yeah. So all the specialist staff are on the academic contract, and all our staff are contracted to deliver 828 hours over the academic year. So roughly, when we look at the number of weeks and those things, staff have about 20 to 24 hours, this is as a full-time equivalent, contact with a learner. But however, some learners may have 1 hour a week, some students may be daily, some students may be 2 hours a week, some students may be fortnightly, and so it depends really on the individuals. And what we also try and do is split the types of learners as amongst the team, so that there's a cross section of those learners that need 1 hour, 2 hours, 3 hours, or a weekly or fortnightly, to kind of evenly spread it. But there could be up to 30 or 40 learners that each specialist full-time equivalent member of staff has as a caseload, I imagine. But then obviously, as students have been through the programme, that student may come off and new referrals will come through. But it is a juggling act, and it is really difficult, and we do have to look at moving students on, so that we can take other students throughout the academic year. We do have to at times use some agency staff to continue to support the learners when we have so many referrals coming, and we're fit to burst, really, aren't we, at times?
Yeah.
And Kerry's asked, do you use disadvantaged funding to support any of this?
That's with the college. I uses some of that, yes, that would support the area and support the welfare. That would be part of the welfare team, the healthcare assistants, and some of the support that's provided. What we will do is we will make sure that we will send out that information tomorrow to you. But thank you for staying and listening to us this afternoon. We hope that it's given you some information about what we do at the college, some more detailed information about how we provide that specialist level of support for learners. Just to highlight, as I mentioned at the beginning, I can still use the clicker. We do have an event running next Thursday, and we do have some spaces available. You can go onto the ETF website and register through Eventbrite. So if you want to access it next week, but this gives you an overview of what's happening next week, and some of the key speakers that are coming to really look at a young person's journey and some of the mental health issues and challenges that they may face, and looking at, as a sector, as a group of colleges together, what we can do, what further to support the young people, because we know that mental health in young people is on its rise, and it's about how we're going to respond to that as the sector. So there'll be lots of opportunities to network and talk to other colleges who are in the same situations. Was that one more question there?
From Kerry, yeah. She says, is this model for HE and FE?
It is for FE, actually, because HE uses the DSA, as you'd be aware, and it's slightly different. We like to use the same model, and we do have specialist staff that are employed through the HE teams, but it can be much more prescriptive for an HE learner in what they can access and what they can't access. But what we do is we work really closely with the HE support teams when learners are progressing into HE, especially within our own HE provision, and our local partners, so that they're aware of their difficulties, and as encouraging learners to be able to share their information with the university that they're progressing onto. And also it's about looking at those students that are going externally to universities outside of our kind of local area, and looking at what support's available and for them, and helping them to access a DSA. So we will be around for any more questions for a couple of minutes, but as I said, thank you ever so much for joining us this afternoon, and we'll be in touch tomorrow with all those details that you've asked for. So thank you.